Angelico Maldonado died on August 22nd from damages left behind by COVID-19. He spent 6 weeks on a ventilator before having to be disconnected. He was undocumented and uninsured when the pandemic hit. He was also the main breadwinner for his family, now leaving them in financial distress.
My father was 68 years old. Retirement was not an option, at least not for him. He lived with my mom majorly, so of course he was the bigger income there.
Originally from Oaxaca, Mexico, Maldonado came to the U.S. 35 years ago and spent over 25 years in the roofing industry in San Diego. Before being hospitalized, Maldonado feared the cost of medical care and being deported if seeking help, a fear that lives in many Latinos today.
My dad didn't have insurance, so of course he couldn't call his doctor and say, hey, what do? I have fever. I've been having fever for so long, and that wasn't an option that he had.
Neither was working from home. Maldonado continued going to work during the COVID restrictions as roofing jobs got busier. For many Latinos, working from home is a luxury that they don't have or simply can't afford. These are the types of cases the Chicano Federation often sees when helping families navigate the burdens of the pandemic.
And we see that every day. We talk to folks who are these essential workers who say, I'm sorry, but I have no choice. If I don't work today, I might not be able to pay rent tomorrow.
Alcantar says other factors driving the COVID cases up in the Latino community are the underlying health conditions and lack of access to health care. Latinos also frequent public transportation more and live in multi-generational households. As a roofer, Maldonado frequently interacted with many different people. He was diabetic, had no access to health care, and lived with his wife, children, and grandchildren. All of these elements made him more susceptible to catching COVID-19.
There's been absolutely no help for our undocumented families in our community who contribute greatly to our local economy, contribute greatly to our society as a whole, and yet they've been excluded from this help.
In July, when Maldonado, his wife, and several family members were diagnosed with COVID-19, they were left to pay out of pocket to see a doctor and get tested due to having no insurance. That is when the financial stress began for the Maldonado family. After diagnosis, everyone with COVID was forced to go into quarantine.
Again, when we got COVID, we were out of work for a whole month. This was definitely not something we were planning to go through.
Maldonado's wife, Maria de Los Angeles, is a legal U.S. resident working on Camp Pendleton. She and her husband plan to return to Oaxaca in January to retire. Plans that have now changed, forcing Angeles to depend on her children for financial support.
Después de tanto tiempo de estar trabajando aquí,
she said, it's a shame. After all these years of working here, we have nothing built here.
Nada.
While Maldonado was approved for emergency Medi-Cal, the family still hasn't seen a final hospital bill.
Nosotros como familias latinas,
she said, Latino families like us live day by day just to pay rent, pay bills. We don't have enough left over to save money. Now for me, it's going to be more difficult because my partner is gone. Tania Thorne, KPBS News.